Rewarding careers, experiences of a lifetime. Explore Travel PT at aureusmedical.com. AUREUSmedical.com.
NPTE StudyCast.
All right, welcome to NPTE StudyCast, the podcast that helps you get through the NPTE exam. Today on the show, we bring in Stacy Menz. Stacy, welcome to the show.
Thank you. Thanks for having me.
Stacy, a pediatric physical therapist on the West Coast. Where are you located?
In the San Francisco Bay Area.
Can't complain about that. Starfishtherapies.com is where you can find out more about Stacy. In this episode, taking an in-depth look at Down syndrome. When we start there, how do you describe that pathology briefly when you're working with it?
Down syndrome is a genetic disorder where the child has an extra copy of the 21st chromosome. It can be a full copy or a partial copy, and it results in trisomy 21.
And now, what's involved when you're working with a child with Down syndrome? You know, what are the typical things involved? Because it's not necessarily all-inclusive. It can be some or all of a list.
Right. Definitely facial features that are very common. It includes like a smaller head, a flattened face, a shorter neck. They sometimes have a protruding tongue, upward slanted eyes, smaller ears. But that doesn't necessarily affect what I'm doing as a physical therapist. We do see some intellectual disability, and that can be on a spectrum, and that can definitely have an impact on how they progress with motor milestones. They also have developmental delay, which is a delayed progression of their developmental milestones. Some of them have heart disorders, so you might have to take that into consideration when you are working with them. Other thing to check out is their atlantoaxial instability. The ligaments aren't stable enough to hold the vertebrae in the places they need to be. So one of the precautions is no forward rolls for the child unless they've had it cleared by a doctor. The biggest thing that affects how we're working with the child, though, is their lower muscle tone. And that can, again, be a spectrum that causes them to present as weaker. It takes a lot more effort and energy for them to use the strength that they have, and they have to put a lot more work into developing the strength. The way I tend to describe low muscle tones, people, including therapists and parents, can really understand it is, if you ever gotten home from work on a Friday, sink into your couch, and maybe you have a cold beverage in your hand, but you're like, and then somebody calls you from the other room and you have to get up and go see what's going on. And that energy it takes to get up out of the couch is the energy it takes for kids with low tone to turn their muscles on each time they've stopped using their muscles.
That's a good way to describe that, using a feeling that we've all experienced before.
Special tests.
Testing sometimes appears on the NPTE. If this were to be a testing question, what sort of tests come in with Down syndrome?
Many kids are diagnosed prior to even being born with the development of a lot of the prenatal testing that's happening. A blood test that can be done, draw a sample of the mother's blood. They can see if any of the DNA shows the extra chromosome because they're going to know it's not from the mother. Also, the nuchal translucency test. And again, that would be something that we wouldn't be doing as a therapist. There is also the amniocentesis, which is where they're going in and drawing before it's born, and the chorionic villus sampling. Once the baby's born, if they weren't diagnosed, this can be done on features, but they will also do a chromosomal karyotype to diagnose.
Differential diagnosis.
Differential diagnosis. Most of the time, I think, in physical therapy, if you're going to work with an individual with Down syndrome, typically they have a diagnosis. But let's just pretend this is going to be one of those differential diagnosis questions. What are the things that could come into play?
So some other ones that could present similarly would be trisomy 18, which would be an extra copy of the 18th chromosome, multiple X chromosome, and Zellweger syndrome and other paroxysmal problems.
Treatment examples.
Treatment examples, you alluded to it at the top of the show in terms of things that might be focused with an individual with Down syndrome. What are some treatment examples that you would give?
A lot of it is, we're working on strengthening because of the low muscle tone and postural control, being able to turn on those postural muscles and maintain them so that, you need that nice foundation in order to do anything off of it. So your arms and legs don't work as effectively if your trunk isn't stable or your head is not stable. You're going to go from there into more coordinated activity. So now you're getting the strength, but how do you use that? How do you coordinate your muscles together? So you're going to be working with these kids because you're going to see them pretty early on, working with them on going through the developmental progression, starting with rolling and sitting and crawling, getting into standing, walking. They definitely progress. However, it's going to be not only delayed, but generally a slower rate of progression than typically developing peers. We're also going to look at ways to educate the parents to help prevent any damage because they are very flexible due to ligamented laxity. Not only do they have low muscle tone, so they're a little bit floppier, but their joints are less stable because they have more lax ligaments. Other thing we really do is really work on getting regular exercise in there because they have to work harder to do things and they're a little bit more delayed getting skills. But the more that you can keep them active, it decreases their risk of obesity because as they get older, they tend to have an increased preference for sedentary. The other thing we'll do is orthotic recommendations, using orthotics early on to help provide a more stable foot to get kids walking sooner. That can help with earlier independent exploration, which is always our goal with kids. We want them to be able to explore their environment sooner. It helps with a lot of other development, not just growth motor.
What to know for the test.
Final part of the show that we do is really a sample question. How might this look on the NPTE?
So one of the questions we came up with is, which of the following is not a typical presentation of a child with Down syndrome? Hypertonia, ligamentous laxity, delayed acquisition of motor skills, excessive flexibility. And the answer would be A, hypertonia, because we've already discussed that they have low muscle tone, not high muscle tone.
Yeah, you'll see that in the NPTE a lot, which is something similar to that. They'll ask you, one of the answers will be hyper when the actual answer is hypo. So make sure you're actually reading the question and the answers very, very carefully before you go ahead and select while you're taking the NPTE. That's a take a look at Down syndrome with Stacy Menz. Stacy, appreciate your time with that one.
Thank you.
Download free study guides now at aureusmedical.com/NPTE StudyCast. aureusmedical.com/NPTE StudyCast. Rewarding careers, experiences of a lifetime. Explore travel PT at aureusmedical.com.
NPTE StudyCast. Brewed by the PT Pintcast.